Sanjay, Christof, thanks so much for joining me once again. A year on, we're back in sunny Barcelona, and I'd love to know what have you achieved, been working on in the last year, and perhaps more importantly, what can we see in the next year from your two companies?
Yeah, wow, that's a big question. So we've been busy this past year together with Microsoft. We now actually have deployments in the large pharmaceutical organizations around the world, at least on the prescriber engagement side of things. We've done a lot of very interesting stuff with AI and machine learning, which we had conceived of and thought about and always knew was possible, but the last year has seen it come alive. So that's been really exciting. And then in terms of the future, we've also sort of become clear about the fact that to do digital transformation and to enable it in the years ahead, the old ecosystem of having different systems for different functional areas is really one of the key obstacles. So our roadmap has also evolved in this past year to include many more functional areas like marketing and event management and in fact even beyond just the prescriber engagement side of things, even thinking about what is happening on the patient engagement side as well, because we think this kind of a comprehensive ecosystem removes the obstacles to do interesting digital things right in the next 3, 4, 5 years. So as you can see, it's been a pretty packed 12 months.
Sounds like you've been working hard, achieved a lot, and really actually making a difference, not just on the technical side, but also in terms of what our end users see. Curious to understand, you've got a customer-centric and a patient-centric view coming shortly. Is it all part of the same ecosystem?
In the strategic alliance with Microsoft, we have a partner who has not just sort of the one platform or the other platform, but a whole series of capabilities. So we have a lot to work with, and we've discovered a lot of what's there, like hands-on, in this past year, and that's allowed us to have sort of the ability to build, a comprehensive prescriber and in the near future the patient engagement ecosystem using a lot of the Microsoft cloud capabilities.
Yeah, and from Microsoft perspective, you can think of, we have essentially 4 platform offerings, right, at global hyperscale, right? So number 1 is of course our intelligent cloud, which provides you all the AI capabilities. It's Azure, right? And then we have M365, which essentially covers Windows and Office 365. And then of course we have Dynamics as number 3. And Dynamics is really there to bridge the gap between the traditional CRM and the ERP systems and to really come up with intelligent business applications. And then, of course, we have LinkedIn, not to forget.
Essentially, it sort of becomes the power of 5 clouds, right? There's all of that capability from Microsoft, and then you add the life sciences, compliance, business process, data model, training for the algorithms, and things like that. And then you really have this reality of this type of a comprehensive ecosystem. And the thing is, our claim is not that this by itself will do everything and transform everything, but it's like with this, you then have a foundation on which to do innovations, right? Versus today, it's all fragmented. And if you think about patient engagement, there's real world data systems, there is commercial communication systems for patients, there is consumer ed, there is, all different things, and nothing has really got the common backbone. There has been more kind of consolidation on the prescriber engagement side of things, but even there, it's still today, after all this investment and effort and hard work, there's sales, there's marketing, and there is content repositories which are different, and then the analytics on top of this are also quite disconnected, and it always kind of makes me scratch my head that how will you do transformation if this is what your world looks like, right? It's easy to talk about things, and at scale, right? It's not just about doing one cool thing in one part of the world, but if you want to do this at scale globally, then how do you do that?
This is why I was outlining hyperscale, right? These platforms, this is hyperscale, global, available. And to enable this and to overcome the silos Sanjay mentioned, right? Data interoperability is a foundational enabler to get across these silos. But along with this data interoperability, of course, we have to consider ethical frameworks and establish those ethical frameworks around this data interoperability. Also to enable then to share the data between the different healthcare ecosystem partners to the benefit of the patient.
Well, it sounds like you've created a fairly solid foundation which the average commercial manager or director is going to be able to actually use and become more creative and actually work on some really interesting ideas based off that. I suppose what I'd really like to know is if you were in that position within a pharma company, what are the sort of capabilities and activities that you are now going to be capable of actually achieving with this setup?
So that's actually a really good question. Like, so we got all this foundational stuff. It's all very exciting: ecosystem, data models, business process. So what is it gonna do, right? Which is exciting and which. So the way we like to think of it is, in the end, there's really just two things to digital transformation, right? Customer experiences and making things more intelligent, both internally and in the interaction with the customer, right? So the right question, I think, to ask if you were in that position is, and with that type of responsibility is, what is the customer gaining, right? And by customer, we mean both prescribers on the one hand and in the near future, patients on the other. We spend all this money, there's all this subscription software in so many countries, all the effort that goes around it, developing content, factories, whatnot. What does it actually achieve for the customer, right? Are they experiencing you as an organization in a more coordinated fashion? Are they experiencing you in ways that they could not before? Are they experiencing you in ways that they already expect and get from other industries, right? As just human beings. I think that's the kind of the enablement that we see this foundation creating. So in the near future, you may want your customers to be better off by interacting with digital content in completely new ways. There might be bots, there might be social communications, there might be augmented reality type communications. Yep. If you don't have this foundation, everything will be a big project, big investment, big effort. And in the end, it'll be in one country or two countries or one brand or two brands. That's not what banking does. That's not what Amazon does, or what Microsoft does, or these organizations do. So to be a cost leader, you really have to think about these types of foundational things to be able to improve customer experience. The second thing, as I said, is really about are we truly becoming more intelligent? So I'll give you an example. You think about how well you know your prescriber customers. Well, you know them a lot. You know their prescription habits, or their information consumption. And you sometimes might even use that to do things like, segmentation or targeting, whatnot. But do you think large class leaders like, Uber or whoever are sitting there doing segmentations, right? I mean, they know who customers are connected to, who are the influencers, what are the peer groups. In our industry, that would mean, for example, on an everyday basis, knowing what different customers are actually interested in terms of medical topics, using that type of intelligence to develop content, to disseminate information, to make things more personalized. I mean, there's so many things you could do, but broadly, I think it's really about, are we improving customer experience, and do we have the foundation to be able to do that fast and everywhere? And are we doing things more intelligently?
Yeah, and I think key for this things doing more intelligently is really independent of the channel to provide the right information at the right time. And this is where then artificial intelligence really adds value. And you have to apply it to make it real, right?
Okay, so I understand pretty well how you are reaching out to your customers, but what about listening? I'd like to understand a bit more about what data capture you've got and what the AI is actually capable of working on. So how do you go there and actually achieve the required amount of information and level of information, quality of information that you're looking for?
It's interesting, I heard a lot of sessions here about data and data being this and data being that. But interestingly, we are a very data-rich industry. We know a lot about our customers and our our medicines and our products and the disease states that we work in. I think the trouble really is that we haven't really mined that information and automated that using intelligent technology. So to give you a concrete example of what that means is, we're working together with Microsoft on something we call the deep customer graph, right? So to understand an individual customer, in this case a prescriber at the moment, from the perspective of what has their journey been, right, through all the different channels and interactions and so on. What has been the specific interest that they have, right, in terms of specific medical concepts or topics that they're interested in. And as I said earlier, what are their relationships, right, amongst their peer groups and people that they practice with or people that they interact with during their research and so on. So it is possible, we know now because we've been doing this, to have machines which are able to mine the various information within the compliance limitations and requirements to develop this sort of deep understanding of each individual customer from all angles. It's not just their journey. So if we had this at scale, it could work anywhere in the world with all types of prescriber customers. Then you can imagine that you have something truly ahead of what's been done so far to improve the experience of the customers.
Yeah, and if you then think this further, right? If then ultimately you can shorten time to treatment, then you have the ultimate goal, right, achieved, and you have happier patient with better patient outcomes.
Yeah,
which will then, of course, justify for fair reimbursement.
So as somebody responsible for, the technical side of our businesses, would this be a major implementation? How much of this is cloud-based versus being able to, or having to have more sophisticated implementation procedures?
I'm very glad you asked that because we also believe that to be able to do transformative things, you ought not to spend years and 80% of your investment and energy just standing up the basic foundation, right? That would be like building the foundation for years and then not having enough money left to build the actual building, right, or the house. So we focus on the sort of fantastic things that we see at Microsoft in their world. Mm-hmm. For example, nobody talks about implementing LinkedIn, right? It's there, it works.
It's there. You can use it.
You can use it, right? It does what it's supposed to do. It does it well. Yeah. It's constantly improving. In this past year, we've done implementations which have gone from start to live in 10 weeks. So traditionally, when you think about complex customer engagement systems like CRM, marketing automation, it's never 10 weeks, it's years, right? But we think that is a barrier because by the time we've actually created all that and done all that work, then now you need even more investment and even more time to do the really interesting and innovative things which improve the customer experience. CRM, by the way, will never improve a customer experience, right? It's just a repository. But the stuff that you do with it to improve, if that's 2 years down the road, we think that's a way of the past, not the way of the future.
Yeah, and for example, with the platforms, right, with bot frameworks, what we offer, you can, if you take a FAQ website, you can, within minutes, you can change this to become a bot, right? This is the easiest use case for bot. And this is how you can transform customer engagement and then also a patient engagement later, right?
So I sense an increased level of confidence from talking to you compared to last year. With that new confidence, I'm very intrigued to know what perhaps might sit in your development pipeline or indeed your imagination going beyond a year from now.
Yeah, for example, last year we started to come up with a complete compliance solution, having privacy controls inbuilt for patient engagement, the healthcare bot, right? And this year, for example, we extend this, and we will also include then patient recruitment capabilities. And the beauty of this is really customers like pharma companies, they can leverage this healthcare bot and simply use the compliance and the privacy controls, which are part of the product, right? Which helps them to scale immediately. And this is really acknowledging all the regulatory needs, a pharma company has. But with these kind of software as a service-based solutions, providing all the regulatory elements, pharma companies can also transform how they interact with patients.
One big driver of this type of air of confidence, I think, in this past year has really been the I would say the intensification of everything, right? We've intensified our development efforts. We have learned a lot more about and been positively impressed and surprised by the level of technical width and depth available from Microsoft. So we know we have a lot more to work with, right, to do these things that we have always maybe even known about or dreamt about. But now we are able to actually do some of these things. So I think the intensification of our customer deployments have been, more than we did in the year previous, right, in this past year. And I suspect will only be even more in the year ahead. So I think it's just a general kind of higher intensity of our roadmap, of our deployments, of our kind of ability to do these things that have been in our vision.
Thank you, guys. You've given me a really good understanding, both of you, of really what we've got and what we can expect to see. I sense that confidence will be transferred to your customers going forward, able to do a lot more than they were able to previously. So great work, and keep it up. We'll see you next year.
Sounds good.
Thanks for having us. Thanks.
Thank you.